Under the new health care law, everyone must be enrolled in a health insurance plan or pay a penalty by next year. With the opening day for the health exchanges less than a week away, many people still have questions about how the program will work.
Here in New York, people looking for health insurance will be able to turn to a network of agencies around the state to help them enroll. One of the partner organizations is the Community Service Society of New York. To walk us through what will happen here and throughout the country, we're joined by its Vice President of Health Initiatives, Elizabeth Benjamin. Welcome to Democracy Now!, Elizabeth. You're chosen as you've been qualified as one of thousands of navigators throughout the country who are officially empowered to help people. So what happens on Tuesday, October 1st?
Sure. What happens on Tuesday is the state-based exchanges and the federally facilitated exchanges, or what we now call marketplaces, will be open for business. That means there will be these websites, essentially. There's one giant one for the entire country. It's at www.healthcare.gov. Will be open, and people will be able to put in some basic information about themselves and who lives with them, and then set up a little account, a little username and an ID. Then they'll put in information about themselves, their family. They'll indicate if they have a Social Security number or not. They'll put that in. They'll put how much their income is roughly, and then they'll be processed and determined whether they're eligible for financial aid to buy health insurance. And then once they decide if they're eligible for financial aid to buy health insurance, then they can select between the different plan options that are out there. So basically, people will be able to start shopping for health insurance in a way that does apples-to-apples comparison.
And now you mentioned in the state exchanges and the federal exchanges. Could you explain the difference? Where the states are running them as opposed to the federal government, and why?
Sure. There's 17 states that have decided to move forward with the implementation of the Affordable Care Act. There's 7 states that are sort of halfway implementing it, and another 27 that are just saying, we don't want anything to do with this. We're just going to let the federal government come in and run the marketplace for our state. No matter where you are, you will be able to get a wide selection of insurance carriers, and you will be qualified for financial aid. In New York, 3/4 of the people who go to the marketplace will be eligible for some kind of financial aid to purchase commercial health insurance.
So here you are, you go on this website, and you just said, and once you put in all your information, you then choose the insurance you want. I mean, that sounds, to say the least, extremely daunting. How on earth, I mean, first of all, how many choices do people have in New York and all over the country? And how on earth can you figure out what you want? Well,
the amazing thing is it won't be daunting anymore. It's exactly the opposite. Right now, if you're a small business and you wanted to shop for health insurance on the open market in New York State, you'd have a choice of 15,600 products. That's overwhelming. That's complicated. When you go to the marketplace, you'll be able to put in your information. It will give you a very small, it will give you a selection of plans. You will have choices, but the choices will be standardized. You will be able to do a real comparison. You will know exactly how, for example, Aetna compares with Empire or Blue Cross Blue Shield. So for the first time, purchasing insurance will be on a level playing field, which is remarkable for consumers. So it's almost the opposite. It's simpler now.
Elizabeth, now you mentioned small businesses. There have been some, obviously, kinks in the rollout of the program, and some information that, for instance, Spanish language information will not be available yet for several weeks, and also there aren't information on small businesses. Has that been delayed as well, or is that?
No. What's really great for small businesses, there was never a mandate. There was never a stick or requirement for a small business. And a small business is actually quite large. It's less than 50 employees, and that's common law employees. So you could have 80 employees, half of them are half-time or whatever. You'd still qualify as a small business. There's no mandate. There's no stick or requirement for them to offer coverage to their employees. What there is, however, is this incredible opportunity of 50% tax credit. That means, for example, say we have Bob, who owns a body shop, right? He has 7 employees that make $24,000 a year. He lives in Queens. He has this body shop. He's not paying very much money, but his workers are low wage. He can have the federal government pay 50% of the $16,000 insurance tab for that small business. So 50%, $8,000, just the federal government will write. That's a big carrot. And the rest of it, the other $8,000, he can deduct from any income taxes he has or profit taxes that his business has. So it's an extraordinary incentive for small business. So if you are someone that has 2 or more employees, I really encourage you to go what they're called small business or marketplaces or shop exchanges is sometimes the other words that we use for them. There'll be one at the, at the federal level, but there's also one in a lot of the states that are moving forward, and shop through there. What has been delayed was the mandate on large employers to either offer coverage or pay a penalty. Now, that's not so important for the simple reason that 95% of all large employers already are offering coverage. And most large employers offer coverage. Why? Because that's how you retain good employees. So we don't really think the delay of the mandates that significant of an issue. What's really exciting is that there's incredible incentives for small businesses.
Well, also the issue of you mentioning large businesses that already supply insurance. Are there provisions for tax credits for employees who are receiving health insurance but maybe their premiums that they're being offered are too high?
Exactly.
No, not just the 48 million who are uninsured, but actually people who are currently insured.
Right. Some employers do offer coverage, but it's extremely the employee portion, what comes out of your check every 2 weeks, is extremely expensive. If that insurance is over 9.5% of your gross income, of your gross wages, you can then say, forget it, I'm not taking my employer's offer of coverage, my job-based insurance, I'm going to go into this marketplace and get a big old tax credit or financial aid and get insurance through the marketplace. So that's super good. Yeah.
And this issue of the Associated Press reporting that the Spanish language version of the healthcare gov site will not be ready for several weeks.
I believe it will be shortly. I mean, it takes a lot. It's a big project. They're working as hard as they can. The best IT minds in the country are working both on the federal exchange and here in New York, and I think it'll be, bilingual shortly.
And if you don't have access to a computer, what do you do?
Well, that's where people like me come in. So what we are called certified, we're navigators, and we are certified. In New York State, we've been through a very comprehensive 3-day training. We are the place you can go for absolutely neutral, independent assistance enrolling into this marketplace. So you can come to me. I can sit with you with a laptop. I can go to your home. I can sit down with you and walk you through the process, explain.
You personally or your organization?
I'm certified. But my organization, we have, I think, 10 of us already certified. And we have a network of, 40 other groups, 17 of which are chambers of commerce around the state of New York, who are certified to help either small employers or individuals go through this process. What's great about these navigators, and we're all over the country, every single state has them, is that we're absolutely neutral. We are not on commission from an insurance company. We have no opinions about whether one insurance company is better than another. We're just going to help you through the enrollment process. We're going to figure out which insurance companies offer your hospitals, your doctors, how they we can tell you how they rate on the quality ratings for how they do on outcomes for various things, like do they vaccinate their kids by 100% of the kids that are enrolled in that company by age, whatever it is, 2, 5. They keep having more vaccines on my kids. But anyway, so, that's what we can do. But we're paid by grants from the government. We're not on a commission from an insurance company. And that's very important.
You mentioned that there are navigators all around the country. Some states have made the certification and the availability of these navigators extremely difficult. Georgia, for example, or Florida. Could you talk about the difference in how states are dealing with the question?
How people find these navigators.
Either finding them or licensing them. Yes.
Well, we're all licensed either by a federal government through that training, or in New York we do it through a state-based training. We all go through rigorous training, at least 3 days here in New York. There's in-service training that will be going on all along. And people find them by going to healthcare.gov. You just type in, I want an in-person assistance, and this is my state. If you go and type in New York, it'll flip you over to the New York State of Health Marketplace, and then every county has a pop-up. In my organization's in, I believe, 61 out of 62 counties in New York State. There's one county we couldn't find a partner in, but they have great navigators in that county. So we're everywhere in New York, and there's a lot of them all over the country.
And what's the number of Community Service Society? And also, are navigators taking calls now, or is it October 1st?
Oh, we're booking appointments now. I mean, I'm trying to. I want 25 people into CSS on Tuesday. So our number is 888-614-5400, or you can just email us at enroll@cssny.org.
We're going to break, and then we're going to come back to this discussion. We want to ask you about some of the people who have come forward now to ask for health care, for insurance, and how you're going about dealing with them. Elizabeth Benjamin, Vice President of Health Initiatives at a Community Service Society here in New York, and she is one of the thousands of navigators who have been trained all over the country to help people navigate the system that begins on October 1st in states around the country. Stay with us. DemocracyNow.org, The War and Peace Report. I'm Amy Goodman with Juan Gonzalez.
Well, I want to turn to President Obama. On Wednesday, he spoke with Bill Clinton at the Clinton Global Initiative Conference.
And essentially what we've done is we've created what we're calling marketplaces in every state around across the country, where consumers are now able to be part of a big pool. Insurers have to bid, essentially compete for the business of that pool. And what we now have set up are these marketplaces that provide high-quality health care at affordable prices, giving people choices so that they can get the health insurance that they need and they want, and the premiums are significantly lower than what they were able to previously get. I'll take the example of New York State. The insurers put in their bids to participate in these marketplaces. It turns out that their rates are up to 50% lower than what was available previously if you just went on the open market and you tried to get health insurance. 50% lower in this state. California, it's about 33% lower. In my home state, Illinois, they just announced it's about 25% lower.
That was President Obama at the Clinton Global Initiatives Conference. We're here with Elizabeth Benjamin, Vice President of Health Initiatives at the Community Service Society of New York. What about these lowered premiums here in New York State? How was it accomplished? And also, could you talk about the different levels of coverage that people have access to? Because depending on the level, the premiums rise substantially.
That's true. So the reason why costs are lower, and I think the best way to think about it is kind of like a Costco. What you have here is you have the ability, because of the mandate, more people are coming into the market. Insurance works on a solidarity principle, or like a Costco. The more people that go, you have bulk purchasing. If things are bulk purchased, it's highly discounted. And so that's what happened in New York. Right now, if you go on the open market in New York, you're paying over $1,000 a month for one person to get health insurance. The lowest prices on the exchange is it's like $200 before financial aid. So it's really an extraordinary thing that we've been able to pull prices down so much. Going to your second question, which is there's these different tiers, right? First of all, maybe there's two different things that are happening at once that affect prices. The first thing that's happening is you get financial aid based on your income level. So the people that are poorest, like $15,000 for a family of one, those folks will go into Medicaid. But as you go up the income band for one person up to $45,000, there's really, really good financial aid. Now, obviously, the most financial aid goes to the most needy, the people at, say, 200% of poverty, and the least amount of financial aid goes to people at 400% of poverty, so $45,000 for a family of one, or $94,200 for a family of four. So it depends on how many people are in your household. So they'll figure out what your financial aid amount is based on how many people in your household and how much income you have. And then you take your voucher, if you will, your financial aid, and you can apply it to the cost of premiums every month. Now, what premiums do you, but there's different premiums, right? Because some plans are
But how does that voucher work? It comes directly off the premium that you have to pay? Or
Yes.
do you have to pay it first and then get it rebated?
No, there's two ways you can have it. First of all, you can just say, apply it to the cost of my coverage, and your coverage will be discounted automatically, and so then you just pay whatever's remaining to the carrier every month. Or you can say, I think I might be getting a big raise, my income's too unstable, I'm just going to do it at tax time, and I'm going to true up a year and a half later, or a year and a quarter later on April 15th. So it really depends if you want to take it now or take it later. So going to your second question from before, there are different value levels for the insurance companies, and they're ranked on each insurance company will have a bronze offering, a silver offering, a gold offering, or a platinum offering. So obviously bronze is not as good as platinum, just in the metal tiers. And so for bronze, you'll be expected to pay about 40% of your costs all together. It's not every time you go to the doctor, and the insurance company pays around 60%. At platinum, you pay less than 10%, or for example, $200 ever in the whole year. In New York, that's our platinum product, and the insurance company's paying the other 90%. So that's really, the fancier the plan you get, the less you pay when you go to the doctor, but you pay more on that monthly bill, right, to pay for, because it's fancier, it costs more. The other thing to remember is that even if you go for a bronze plan, there's this incredible thing in the Affordable Care Act that you will never have to spend more altogether, deductibles and cost sharing, than, say, $8,000 a year if you're at 400% of poverty, or maybe $4,000 if you're much lower income. People don't go bankrupt for $4,000. People don't go bankrupt for $8,000. Under the Affordable Care Act, we will see medical bankruptcies go away, which is sort of an amazing thing.
One thing I wanted to ask you, because in the existing insurance, those of us who have it, we are bewildered constantly by the co-pays and the deductibles and the donuts, and you can never figure out exactly what your payment is supposed to be. How will this function under the Affordable Care Act?
So you will have two different forms of payments. Number one, you'll have your premium payment on a monthly level, and then you have what we call cost sharing when you go to the doctors. If you have a very inexpensive plan, you might also have a deductible. A deductible means you have to pay a certain amount. Usually in the platinum product, for example, it's $200. In a silver product, it may be as much as $1,000, although there's special cost-sharing protection for very low-income people in the silver product. So you have to pay that before your insurance kicks in. The good news is those deductibles don't apply to things like primary care, preventive care. In New York, it won't apply to drugs. So there's some real protections for people on the deductible side. So there's the monthly bill, and then what you pay when you go to the doctor.
Give us some example of people who are going to go to the system.
So we like this example of Angie. She just graduated from college. She lives in Queens. She's making $28,000 a year as a graphic designer. She decides to go, she's at 250% of poverty at $28,000. So she's not really eligible for any special cost-sharing protection, but she is eligible for a significant monthly coupon. Her monthly coupon or discount, financial aid, whatever you want to call it, is around $176. If she goes for a bronze plan, which is around $300 in Queens, she will get $176 discounted off of that. So the most she'll spend a month is $162.
Ask someone else.
So we have a family of 4 in Brooklyn. They make around $47,000. The wife is a independent freelance photographer. Husband just got laid off. They used to have job-based coverage. Say it happened mid-year. If you get, we should talk about the enrollment periods, but if you get laid off mid-year, you can go into the exchange during the year. If there's good reasons, you can go into the exchange. Otherwise, you have a strict period.
So let's talk about that. October 1st, if you sign up, you get your health insurance October 1st?
No, you get your insurance starting January 1st. The coverage starts January 1st, and this is the only year where you have that gap. So you start shopping in October. It's called the open enrollment period. You have until March 31st to voluntarily get into a plan. If for some reason you don't do that, maybe a job-based coverage, and then you lose job-based coverage in July, then you can get into the exchange and get financial aid.
What if you get hurt in April, so you decide, oh my gosh, I need insurance?
Then you really might be out of luck. You won't get the financial aid.
But talking about pre-existing conditions now, that's okay?
Yeah, there will be no pre-existing condition exclusion anymore.
And of the 48 million, roughly, Americans that don't have health insurance, how many are expected to actually be covered by the Affordable Care Act?
Well, it's a little confusing because of the Medicaid wrinkle that the Supreme Court did, but originally they thought it'd be 15,000 people in Medicaid and around 15,000 people getting financial aid. What I do know is that 3/4 of the people that go to the exchanges, at least in New York, will be eligible for some kind of financial aid or Medicaid.
3/4 of about, what, in New York, it's about 2.3 million or so?
No, there's 19 million people in the state. 2.3 million are uninsured,
right.
And so they're expecting about 1.1 1.1 million people to go into the marketplace.
Elizabeth, I want to turn to a new ad on the Affordable Care Act that's produced by Generation Opportunity, an activist group with funding ties to the conservative Koch brothers. The video shows a nurse escorting a young woman into an exam room for a gynecological exam. For our radio listeners, I'll do some narration for the parts you can't hear.
Oh, I see you chose to sign up for Obamacare.
Yeah, it's actually my first time here.
Well, here we are then. Change it to a gown, and the doctor will see you soon.
Okay, well, your vitals look good. Any changes in your diet or exercise? Mm-mm. All right, can you swing on over, scoot on down, and try to make yourself comfortable? Okay, let's have a look.
The doctor walks out of the room. The woman's alone with her legs up in stirrups. And all of a sudden, Uncle Sam pops up between her legs. She screams. The note here says, "Don't let the government play doctor. Opt out of Obamacare." And he's holding up a speculum, and it says, "Opt out" again. So, Elizabeth, the debate that's going on in Washington and what it means to say opt out, is it possible this won't happen, that the Republicans will succeed in preventing the October 1st opening of the marketplaces from happening?
Absolutely not. The marketplaces are up and running. The beta tests have been done. You can go in already and start playing with your income amount. And October 1st, there will be plans up, and you will be able to start doing comparison shopping and qualifying for financial aid. So,
and reproductive health care for women, how women choose what's covered if they can go to the clinics of their choices?
Right. Well, one of the things that's really nice about the Affordable Care Act is, that most plans will offer, reproductive health care, and you'll be able to have, contraception and no co-pays, and it's really an extraordinary thing.
That's new under the ACA?
The Affordable Care Act, correct. It's considered preventive care.
And it happens no matter what. With the debt ceiling, it happens no matter what.
October 1st, the marketplaces are paid for. The insurance plans have made their, the president, they basically laid their bets. They've dropped their prices. They think people are coming in. The insurance industry, I think in this case, really understands what's going on. And for the insurance industry to drop their prices by over 50% in New York State means it's going, full steam ahead.
And in California?
California, they say over 30%.
Oregon?
No. I thought it was over 20%.
And Elizabeth, those Americans who choose not to participate in the Affordable Care Act, what are going to be the penalties, and how will they be assessed? And since this is now a requirement for individuals.
Yeah, they start the Affordable Care Act. Gets that people, not everybody may be able to do it at once, right? So, and they really expect sort of a phasing in of participation. So the first year, the penalty is relatively small. It's $95 or 1% of your income. So that's not a lot of money. And how that would be levied, if you will, would be not this coming April 15th in 2014, but in 2015. So it's a year and a quarter away. And so you really, you have to show that you got some kind of coverage next year, and then you can avoid paying that penalty.
And in subsequent years, it's expected to rise?
Yes, it goes up to, for example, 2%, a maximum of 2% of gross family income, and then 3%.
Elizabeth, I want to thank you very much for being with us. Community Service Society is her organization. She's Vice President of Health Initiatives there. And again, if people want to get in touch with Community Service Society, can they call from other states?
They can. We would probably send you to healthcare.gov. I think it's better if you live in another state to go to www.healthcare.gov. They also have a toll-free number with live answer operators. It's right there on the website.
So you can be directed to a person who will help you navigate through this.
Yes.
And the Community Service Society number?
For people in New York, it's 888-614-5400.
Elizabeth Benjamin, thanks so much for being with us. This is Democracy Now!, democracynow.org.